Okay, now, good afternoon, everyone. My name is April Wright. Welcome to today's Seaside webinar. Had a few technical difficulties. Um, Welcome to today's webinar, What do libraries have to do with the precision medicine revolution? My name is April Wright, and I am the Community Engagement Coordinator for the Southeastern Atlantic region. Before we begin, there are a few administrative things I'd like to go over with you. If you are sharing or communicating, asking questions in the chat box, please be sure to send to all attendees so everyone can see your questions and information shared. And there will be a time at the end to ask any questions. Okay, for captioning, live captioning for today's webinar, the link is in the chat box. So, as I said, my name is April Wright, and I'm the NNLM All of Us Community Engagement Coordinator for the Southeastern Atlantic region. Today, I want to tell you about the All of Us Research Program and the role libraries are taking to help promote its success and build healthier, more educated communities. The NNLM All of Us Community Engagement Network is the partnership between the NLM and the National Institutes of Health National All of Us Research Program. The goal of the partnership is to leverage the important role public libraries play in their communities to increase health literacy and to promote awareness of the All of Us Research Program. Let's start with a little bit about NNLM. In case you're not familiar, the National Network of Libraries of Medicine is the outreach arm of the National Library of Medicine, and it is comprised of 8 regions, each with a regional medical library, which provides educational opportunities, connections to other network members, and funding for professional development and health literacy outreach projects. The mission of NNLM is to advance the progress of medicine and improve public health by providing all U.S. health professionals with equal access to biomedical information and improving public access to information to enable them to make informed decisions about their health. Now, what is the All of Us Research Program? Well, it is an initiative by the National Institutes of Health asking for 1 million participants from diverse genetic backgrounds, lifestyles, and environments to contribute their health information to a large biomedical data set, enabling research on more precise, individualized medical treatments. Its mission, to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care. Now, the emphasis of this program is to capture the country's rich diversity to produce meaningful health outcomes for communities historically underrepresented in biomedical research. So people of color, people of diverse sexual orientations, and gender identification, older adults, people with disabilities, and people living in different environments with varied lifestyles. Now, what is precision medicine? Precision medicine is a new approach to improving health, treating disease, and finding cures. It acknowledges that each person is unique, our habits, our environments, our biology, and that the interaction of these factors greatly impacts our health. These unique variables also mean that a medical treatment that works for one person might not work for another. Rather than using a cookie-cutter, one-size-fits-all approach, precision medicine aims to deliver the right treatment for the right person at the right time and keep people healthy longer. Ultimately, precision medicine can produce more accurate diagnoses, earlier detection, and better prevention strategies and treatment choices. Precision medicine is a radical shift in how each of us can receive the best care possible based on our unique makeup. Now, here are some questions the All of Us Research Program may help answer. How can we prevent chronic pain? How do we develop better treatments for diabetes? How do we slow or even stop the different kinds of dementia? And how can we help reduce health disparities in a way that is sustainable? Now, what is the value for participants in the program? Well, it's an opportunity to help understand disease and improve the health of other generations. It's also an opportunity to have your community represented in biomedical research. Participants are considered partners in research and have access to all of the information that they share with the All of Us research program. Now, what All of Us does is whole genome sequencing, which it currently costs an average of $1,000. So All of Us will do a whole genome sequencing at no cost to the participant. And, they share the information with participants. And participants also have access to genetic counselors for free to talk about their DNA results. And, the genetic counselor can provide a counseling report and educational materials about their results. That can be shared with one's family or with the healthcare provider. And how is All of Us different from general clinical trials? Well, All of Us is rooted in precision medicine. And as I said before, precision medicine is a radical shift in how each of us can receive the best care possible based on our unique makeup. All of Us serves as a national research resource to inform thousands of studies. So it will cover a variety of health conditions, not just one particular one, which is what a lot of clinical trials do. It includes many people. It aims to include many people who haven't taken part in medical research before. And as the volume of data grows, patterns may emerge that wouldn't be visible on a larger scale. And as I said before, participants are partners. So they'll have full access to the data they share and information about all of the research projects that use All of Us data. Now, what do libraries have to do with precision medicine? Enter the NNLM All of Us Community Engagement Network. The purpose of the Community Engagement Network, or CEN, is to help public libraries support the health information needs of their users by providing funding specifically for programming, which helps promote awareness of the All of Us research program and provide programming resources. I'll say again, the mission of All of Us is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care. The mission of NNLM is to advance the progress of medicine and improve public health by improving public access to information to enable them to make informed decisions about their health. The NNLM All of Us Community Engagement Network characterizes the partnership between NNLM and the All of Us Research Program. The partnership leverages the role of libraries in their communities as trusted information providers. Now, some of the goals partnership between All of Us and NNLM are to increase capacity of public library staff, equip public libraries with information about All of Us, and to highlight public libraries as a technology resource. The libraries form a critical part of the learning ecosystem the All of Us research program wants for participants of the program by providing community education and community engagement. Now, community education, it's health information literacy. Robust training for librarians on how and where to find reliable, accurate health information, and they're passing the information on to their users, some of whom will be participants in the All of Us research program, is part of that. And NNLM aims to support libraries in providing digital and health literacy training and programming in their communities. Community engagement is about seeking out opportunities to connect public libraries with health sciences libraries and other health-related organizations to do health programming and programming outreach, resulting in libraries connecting their users with reliable, accurate health information. Now I'll tell you give you some examples of projects that have been funded by All of Us Community Engagement Grants. The South Carolina State Library has a program called Read, Eat, and Grow, which was inspired by the Culinary Literacy Center of the Free Library of Philadelphia. And they wanted to offer that, programming on healthy cooking and eating because of high rates of obesity and heart disease in the state. They purchased a Charlie Cart, which is a mobile kitchen to deliver culinary literacy programming. A project funded by NNLM is the Precision Medicine and Future of Library, Future of Medicine exhibit. And the exhibit includes programming and engagement resources on precision medicine that can be used to engage library communities around health and wellness topics, provide awareness of all of us, and provide programming that local libraries can partner with other NNLM members and all of us partners in their area to offer. And in light of COVID-19, there is also, we have a website that is dedicated to the precision medicine exhibit. I can send you that in email. I don't have it right now. The Nashville Public Library has an initiative called Be Well at NPL. This initiative offers health literacy programming to staff and the public, along with wellness programming, including yoga, cooking, meditation. And the Be Well at NPL program provided a natural framework for Nashville Public Library to expand their offerings and partnerships with NNLM All of Us funding. One of the things that they've done is they did a screening of the movie The Immortal Life of Henrietta Lacks, and the discussion was moderated by a professor of ethics from Meharry Medical College. They also partnered with Vanderbilt to train library staff in addressing health-related reference questions. Now, another program that they offered was Be Well Bingo, which highlighted and explained health insurance terms. Now, All of Us Memphis, the Memphis Public Library has a health information center at its central branch, and it has expanded to include a health information center in other branches of the system, branches that serve populations that are underrepresented in biomedical research. They have also partnered with the University of Tennessee Health Sciences Center to provide training to library staff. And they have also hosted health fairs at their branches and partnered with the UT Health Sciences Center to host the All of Us Journey educational exhibit. The All of Us Journey is the All of Us research program. It's a bus that they use in order to promote awareness of all of us. And it travels around the country and provides information about precision medicine and the All of Us research program. and libraries can host or volunteer to exhibit at an event with the journey. Now, NNLM provides some tools to support libraries with education and engagement. Now, these are some of the health observances for which NNLM provides program kits and guides. These observances are chosen to align with all of us priority health topics. And then some of the priority health topics are mental health, diabetes, heart health, and nutrition. Now, another offering that NNLM has is the book club kit, which is based on the National Health Observances, and chosen based on the priority health topics. So libraries can request a book club kit, and once again, with COVID-19, it's the way that we're working on offering things is we're looking at offering a virtual version of the of the book club, the book clubs. So it should be an interesting kind of an evolution. But libraries can get these book kits, and they are able to keep them. They're free. They get 8 copies of a book, 8 bookmarks. They get discussion guides, copies of Medline Plus magazine, reading club book bags, and a big duffel bag to keep them in. Now, the program kits are based on NNLM's Activate, Educate, and Collaborate Health Outreach and Programming in Your Community initiative. Now, one of the kits is sharing health stories, and I encourage you to check out a webinar that NNLM had offered in March. It's called Creating a Diverse Archive, Lessons in Community Engagement from StoryCorps. So it's, we're kind of partnering with StoryCorps to tell those, it's family oral history and family health history. So StoryCorps will, go to different libraries as they have before, but this will be in partnership with the National Network of Libraries of Medicine. We also have the Game of Health, which it's a kit that's available to libraries, and it promotes basic health literacy and use of authoritative health information resources. And, at the end of the game, you're either considered, based on your score, you are either a health hero or a health sidekick. So nobody dies, although that has been suggested to kind of emphasize how important it is to have good health information. Now, NLM also has a partnership with SciStarter, which is SciStarter is an online community dedicated to improving the citizen science experience for project managers and participants. That's straight from the SciStarter website. And what they do is they have projects. And this, as you can see from this slide, SciStarter and all of us in National Library of Medicine they've curated projects to highlight on the SciStarter.org. I'll put that in the chat box /NLM. And you can check out that website. But citizen science, in case for those of you who may not be familiar with it, is the practice of people who are not scientists or researchers contributing to scientific, or in the case of all of us, medical research. So some projects include Stall Catchers, which is Alzheimer's research. You can contribute to Alzheimer's research by playing a game. And there's one called Flu Near You, which there's also one called COVID Near You, which is a project to map the occurrence of the COVID-19 virus. And participants simply check in weekly and report how they are feeling. So an easy way to get involved in research. And I would be remiss in my duties if I did not mention the NNLM training classes that we offer. And we're offering a lot of on-demand classes, and you can go to nnlm.gov and see what's coming up. There are recordings for past offerings for some of them, and others we have on-demand courses for. So I highly recommend checking those out. And lastly, the Community Engagement Network has a newsletter, which you can sign up for at the website there, nnlm.gov/allofus. And it highlights funded projects and provides information on upcoming classes and webinars, national health observances, and other relevant information. Now, I have questions for you. What are the key factors that make up precision medicine? I'll give you a second. You don't have to put anything in the chat, I guess. No, just so nobody has to be called out. Okay. All right. And I got one response, yes. And, oh, let me go here. Here we go. Yes. The correct answer is A. So Elizabeth sent me the answer, so great. Thank you. These three factors, environment, lifestyle, and biology, are what could contribute to our health. More specifically, they help determine, why we stay healthy, why we get sick, and how we respond to treatment and medication. Another question for you. People who are carriers of the sickle cell gene are less likely to die from malaria. Is this true or is this false? And I'll give you a second to consider. Ah, okay. Getting a few responses here. All right, well, look. It is A, it is true. People who are carriers of the sickle cell gene are less likely to die from malaria because individuals who are carriers who have the sickle cell trait, one sickle cell gene and one normal hemoglobin gene, have some protective advantage against malaria. As a result, the frequencies of sickle cell carriers are high in malaria endemic areas. That's an interesting little tidbit there. Okay. One more question for you. What percentage of cancer cases are due to family history? Okay. Aha, okay. All right, and the winner is C, 5 to 10%. So between 90 and 95% of cancer cases are caused by environment or lifestyle. Sun exposure, smoking, drinking, foods, pollutants, obesity, stress, and inactivity, which, kind of, it really recommends taking good care of ourselves and being as active as we can. All right. Well, thank you very much for playing. And that actually brings us to the end of this webinar. The recording will be available on YouTube, and you can go to the NNLM YouTube channel. I'll also send out a link for the recording once it's available and posted. Does anyone have any questions for me? Ooh, how would libraries contact you for partnering related to grants in the bus? You can contact me directly at my email, adwright@hshsl. I'll put it in the chat box, hshsl. There you go. Yeah. And we will have another round of All of Us grants around programming coming out a little bit later on. Yeah. Any other questions? Okay. Well, thank you very much for your time and for your attention. And I hope everyone has a good afternoon on this rainy Thursday. Thank you very much. Take care.